I'm the third batsman in this innings of climate and kidney Vadis India stand. The topic given to me is the influence of climate change on renal diseases caused by vector-borne diseases and diarrhea. I am Dr. Rakesh. I am thankful to the organizers and my chief and teacher, Professor Gopalakrishnan sir, for being an inspiration. The WHO estimates that climate change could force more than 100 million people into extreme poverty by 2030. And the incidence of diarrheal changes by 2030 is going to increase by 10%, and it's going to primarily affect children who are the most vulnerable. And this could affect their long-term development in terms of development and cognition. And the quintessential aspects of climate change and kidney disease are: one is very commonly known to us, the prevalence grows with environmental exposure. The other unfortunate factor in climate change and kidney disease is this disproportionately affects socially and economically vulnerable population who lack the access to even basic healthcare needs. So the number of DALI that are attributable to climate change as of 2000, you can see a wide difference between developed countries and developing countries. This was an article published in The Guardian. Global efforts to tackle poverty and climate change must come together. And in that article, the author quotes, "At the heart of the issue is fairness. The poor in the developing countries, those poised to bear the brunt of climate change, lead the least to contribute to this problem." So now, how climate change affects vector-borne diseases? That's an interesting article in the Current Biology magazine, where in 2016 there was an increase in temperature in the Siberian region to around 35 degrees centigrade. And at that time they found that many reindeers and reindeer herders contracted plague and died. When they did a genetic analysis, what they found out was plague, which was eradicated around 75 years back in those Siberian regions, those spores were deep within the permafrost. When the permafrost cooled down, these spores came back again to life. There's a saying in Tamil called Kenarvetta Booda Veliya Vanchana. This is something similar to that. So now, how vector-borne diseases and temperature go hand in hand? As we know, vectors are ectotherms. They love warmer temperature. And these vector-borne diseases are common in tropical and subtropical low and middle income countries. And climate change affects the transmission dynamics, the geographic spread, and re-emergence of vector-borne diseases. As the earth warms, these vector-borne diseases move on to higher latitudes and altitudes where these diseases are not commonly seen. The incidence will increase, the transmission season will lengthen in some endemic areas. Vector-borne diseases and precipitation: more rainfall, more breeding sites. And drought could also provide increase in breeding size as people try to preserve whatever water is available with the containers they have. And this is the ideal breeding place for Aedes aegypti mosquitoes. Now, so many vector-borne diseases are influenced by climate change globally. I want to restrict myself to these 6 diseases. Malaria. The frequency of AK in malaria is 1 to 60%. Pathogenesis: infected RBCs, they obstruct the vessels, eliciting downstream ischemia, that is hemolysis, occasionally rhabdomyolysis, renal histology, acute tubular injury, acute cortical necrosis, sometimes glomerulonephritis. Now, climate change and malaria. These 2 articles is a sample. Altitudinal changes in malaria incidence in highlands of Ethiopia and Colombia. These highlands are not the normal places for malaria incidence in these countries. But this paper shows that as the temperature increases, areas which are not endemic to malaria are becoming malaria prone. The second one, the floods, unprecedented floods in Pakistan in 2022. Few months after the floods, the incidence of malaria in Pakistan jumped up to more than 4 times the previous years combined. Climate change and malaria in India. This is an old article, but this article forecasted that malaria incidence in non-endemic regions in India will increase. Due to the efforts of our government, vector-borne disease, especially malaria incidence, is coming down. For example, in 2020, India is the only country among the 11 malaria endemic regions to have a decreased incidence. But will we lose this advantage if we don't focus on climate change? Dengue. So the AK incidence is between 0.9 to 30.7%. Pathogenesis due to shock, vascular leakage, renal histology, acute tubular necrosis. So when you see this chart, the incidence of dengue has been steadily climbing from 1995 to 2022. There is an upward trend. All of us in our practice, we see rising number of dengue epidemics each year. And this article in 2022, the only state which was exempted from dengue, Ladakh, there are dengue cases are reported, and with that, all states in India are now affected by dengue. And this climate change and dengue association is even being reported commonly in lay press now. Leptospirosis. AK incidence 40 to 87%. Pathogenesis, usually leptospirosis invariably involves the kidney, the direct spirochetal invasion of the kidney, channels are affected, renal histology, commonly tubulointestinal nephritis. Leptospirosis and CKD. It's an interesting article from Sri Lanka, a longitudinal study where they found that leptospirosis infected patients on follow-up, many of them had CKD stage 3. Another study, a population-based survey and epidemiological cohort evidence for leptospirosis and CKD. This was done in Taiwan, where they found that leptospirosis infected patients, they both had a decline in GFR and an increase in CKD. Leptospirosis and CKD-U. This is a review article where they say that when they analyzed Nicaragua farmers where heat stress nephropathy is common, the anti-leptospira antibodies were pretty high compared to the normal population. And when you see the global heat map and compare it to the leptospirosis endemic areas, they both match. Scrub typhus. The AK incidence is between 20 to 60%. Pathogenesis, endothelial injury, direct invasion of kidney, renal histology, commonly ATN. So there are many articles of global increase in incidence of scrub typhus due to climate change. One Indian article from CMC Vellore with a 15-year data set where they have shown that after rainfall and increase in humidity, the scrub typhus incidence is increasing. And one another contributing factor for increase in scrub typhus is globalization, urbanization and deforestation. And this results in a vicious cycle. Deforestation again contributes to climate change. Cholera and other diarrheal diseases. Common in children, common in rural areas and urban slums where sanitation is poor, access to clean drinking water is not there, and incidence of diarrhea related AK increases during summer and rainy season. Both flood and drought can cause diarrhea AK. Flood because of contamination of sewage and drinking water, drought because of lack of access to safe potable drinking water. This is a recent article published in 2023 in JAMA. Previously, many articles about diarrhea following floods were single place studies or restricted to only 1 year. This is a large cohort of data where post-flood or post-drought diarrhea particularly affects children who are very vulnerable, and this has been clearly shown in this article. And again, effect of El Nino and diarrheal admission in Peruvian children. For every 1 degree increase in temperature, they say that 8% of diarrhea cases due to diarrhea patients increase. So the cholera model, this is slightly different. Cholera, the organism is a symbiont with phytoplanktons, and they say that when the surface temperature of sea increases, there is increased number of these pathogenic organisms. Hemorrhagic fever with renal syndrome. A zoonotic infection due to hantavirus contaminated aerosol. It causes acute febrile illness, acute kidney injury and increased vascular permeability. Acute tubulointestinal nephritis is a common pathology. Now, the first evidence of hantavirus nephropathy in India mimicking leptospirosis. It's an interesting study where in Chennai and Cochin, people who presented with leptospira-like illnesses, but they were MAT negative, their sera was analyzed for hantavirus antibodies, and some of the patients were found to be positive. First evidence for serological evidence for hantavirus nephropathy. And this is another interesting study, a seroepidemiological study on hantavirus infections in India, where they chose the high risk cohorts, people with chronic kidney disease, warehouse workers, and tribal population who are involved in rat trapping. And the results were, these tribal people who were involved in rat trapping, they had a high incidence of anti-hantavirus antibody. Hantavirus and CKD-U. This article from Sri Lanka showed that people with CKD-U and people coming from areas where CKD-U is endemic, they had high titers of anti-hantavirus antibodies. This is from Sri Lanka. So there are many non-climate drivers of vector-borne diseases like globalization and environment, socio-demographics, public health systems, vector and pathogen characteristics. It's like a puzzle. CKD-U is like a puzzle with many pieces. Still we are not able to point out what is the single most important factor. I'll illustrate one common factor in all these climate change and kidney diseases with an example. Sometime back last year, I came across few patients in our OPD who had CKD. On further inquiry, they were from a particular area near Madurai called Sakimangalam. And when I asked about their occupation, they said that they go to every street and beg by flogging themselves. They cut their arms and they beg. So when I inquired how many patients of CKD are there in their locality, they said almost every family has one person with CKD, and some of them were on dialysis. So we went along with some friends and went to the place. They live in a very congested environment. They stay there only for a few days every month. They go to different places for their job, and when they come back, they be together. So when I went through their records, what I noticed was they didn't have diabetes. They were on follow-up in our OPD, but this clustering had not been observed. They did not have diabetes. They did not have hypertension. Urine analysis did not show proteinuria, and they had contracted kidneys, maybe CKD-U. What could be the potential factors? Heat stress. They go in the hot sun to do their work. They flog themselves in the hot sun for a long time to do their work. And other than heat-induced rhabdomyolysis, whether this could be self-flogging induced rhabdomyolysis, subclinical rhabdomyolysis due to repeated self-flogging. NSAID abuse. Some of them take NSAIDs to relieve their pain. Contaminated common water source, possible cause. And their dwelling condition is very poor. They usually don't stay at their home. So rat infestations are very common. Whether leptospira and hantavirus infection could be playing a role in them. And these are highly endogamous tribe. They marry among themselves. They don't marry outside. So some genetic factors might also be playing a role.
Rakesh,
so
you'll have to slowly wind up.
So I'll finish in 2 slides then. So the common factor I was mentioning was all climate sensitive diseases, they affect the poorest of the poor, the least of these. See, the common factors are unemployment, lack of access to clean drinking water, lack of proper housing opportunities for them, lack of job. Even these Sakimangalam people, they find it difficult to go to college because they don't have a community certificate. So what could be the solution for all this? One aspect is, as nephrologists, what we can do is identify such vulnerable people, children, another common factor, children, women, old age people. Identify such vulnerable populations, screen them, educate them, health education, renal health education could be given. And as humanitarians, we can go the extra mile and help with their education, we can help with their employment opportunities. So and this will bring down the burden of kidney diseases in these vulnerable people groups. So I conclude my talk with Gandhiji's quote, this could be a compass for our lives. I'll give you a testament, a talisman, a lucky charm. Whenever you are in doubt or when the self becomes too much with you, apply the following test. Recall the face of the poorest and the weakest man whom you have seen and ask yourself, if the step you contemplate is going to be of any use to him, will he gain anything by it? Will it restore him to a control over his own life and destiny? In other words, will it lead to Swaraj for the hungry and spiritually starving millions? then you'll find your doubts and yourself melt away. Thank you.